Welcome back, folks. I hope you are still enjoying these video series that we are bringing to you. So we are discussing the cardiovascular system. We have covered the first indication, that is drugs for hypertension. We are now moving on to the next indication, that is drugs for angina pectoris. And in this video, we will discuss the nitrates. So first let us see the list of drugs which are used in angina pectoris. We have nitrates, beta blockers, calcium channel blockers, potassium channel openers, a group of drugs called as PFOX inhibitors, and miscellaneous agents. So for angina pectoris, we have nitrates, beta blockers, calcium channel blockers, potassium channel openers, PFOX inhibitors, and miscellaneous. So let us start our discussion with nitrates. How do they act? Nitrates donate nitric oxide, something similar to what sodium nitroprusside does. They also donate a molecule of nitric oxide, and we know nitric oxide is a vasodilator. Sir, how does it cause vasodilation? By activating an enzyme known as guanylyl cyclase. Nitric oxide activates an enzyme guanylyl cyclase. What guanylyl cyclase does? Produces cyclic GMP. Guanylyl cyclase is the enzyme which produces cyclic guanosine monophosphate. What GMP does? Activates protein kinase G, and this protein kinase G causes phosphorylation of myosin light chain phosphatase. Protein kinase G, we know kinase means something which donates phosphate groups. So it donates phosphate group to the enzyme myosin light chain phosphatase. And what is phosphatase? Phosphatase is dephosphorylating enzyme. So what does this dephosphorylate? Myosin light chains. This enzyme dephosphorylates myosin light chains. So for myosin to interact with actin, the light chains have to be phosphorylated. If dephosphorylation occurs, then the interaction between the two would be reduced. And as the interaction between myosin and actin is reduced, contraction cannot occur, or rather the smooth muscle undergoes relaxation. So the vascular smooth muscle will relax, and because of this there is vasodilation. So how does nitric oxide bring about vasodilation? This is by nitric oxide causes activation of the enzyme guanylyl cyclase. Guanylyl cyclase produces cyclic GMP. Cyclic GMP activates protein kinase G. This will phosphorylate myosin light chain phosphatase. Phosphatase will dephosphorylate myosin light chains. This dephosphorylation will cause reduced interaction between actin and myosin. This leads to relaxation of the vascular smooth muscle and hence vasodilation. This point we have already discussed. Nitrates are predominant venodilators. The venous dilation is more than arteries. Nitrates do dilate both arteries and veins, but venous dilation is more predominant. And because of venous dilation, what will happen, sir? Because of venous dilation, the blood flow to the heart is reduced, and that is why the preload on the heart is reduced. And as the preload reduces, the heart will have to work less, and therefore it is able to tolerate the state of ischemia. So how do nitrates act? By reducing the cardiac workload. Right? The primary action is they reduce the cardiac workload by venodilation. At the same time, nitrates have another mechanism of action. They also cause coronary arterial dilation. Yes, nitrates also dilate the coronary arteries. So as the coronary artery dilates, the coronary blood flow increases, and therefore the myocardial perfusion is also increased. So meaning, sir, nitrates act by both ways. They reduce the oxygen demand as well as increase the oxygen supply. Correct? By causing venodilation and reducing the preload, they reduce the work of the heart and therefore the oxygen demand is reduced. At the same time, by causing vasodilation, they increase the blood supply to the ischemic myocardium, so the oxygen supply is also increased. And that is why nitrates, because they have both these mechanisms, they are one of the most effective drugs for angina. Right? Nitrates are very effective in angina because they act by both the mechanisms, reducing the oxygen demand as well as increasing oxygen supply. At the same time, another advantage with nitrates is they do not affect the coronary auto-regulation. Nitrates do not affect the coronary auto-regulation. What is this coronary autoregulation and why is it significant with nitrates? We will discuss that later in antiplatelet agents. For the time being, let us make a note of this fact that nitrates do not have any effect on the coronary autoregulation. So this question has been asked, what is the primary mechanism of action of nitrates in angina? Yes, primary mechanism is decrease the preload. Primary mechanism, they cause predominant venodilation and decrease the preload. Of course, coronary vasodilation is a secondary mechanism. The coronary vasodilation is the secondary mechanism. Primary is option B. Right, let us come to pharmacokinetics. Nitrates can be administered by any route. We have oral preparations, we have sublingual preparations, we have transdermal patches, we have IV injections. So any route is available for administration of nitrates. Next question, nitrates undergo extensive first pass metabolism except answer isosorbide mononitrate. Among the nitrates, isosorbide mononitrate is the one which does not undergo extensive first pass metabolism. In fact, we have also seen in the first chapter in drug absorption that one of the examples of drugs with extensive first pass metabolism is nitroglycerin. Nitroglycerin we have seen undergoes extensive first pass metabolism, has to be given orally in high doses. Right. So all nitrates do undergo extensive first pass metabolism except isosorbide mononitrate. Next question, all nitrates are long acting except nitroglycerin. Except for nitroglycerin, all are long acting. So another version in which the question is asked, the shortest acting is nitroglycerin. Okay, all are long acting except nitroglycerin. So the another way in which this question is asked, shortest acting nitrate is nitroglycerin. So sir, if nitroglycerin is shortest acting, which is the longest acting? Pentaerythritol tetranitrate. Among the nitrates, pentaerythritol tetranitrate is the longest acting. So nitroglycerin is the shortest acting, pentaerythritol tetranitrate is the longest acting. Next, what are the indications of nitrates? They are used in angina pectoris. Yes, we have seen that they are one of the most effective drugs. They are also useful in CHF because of a reduction in preload. By reducing preload, they are effective in congestive heart failure. They are also used in hypertension. They cause vasodilation. Nitrates are very good vasodilators. So they are used in hypertensive emergencies. Sublingual nitroglycerin is one of the preparations in hypertensive emergency. Also, they relax the smooth muscles outside the GIT, outside the blood vessels also. So in the GIT, they can relax esophagus and the biliary tree. So they are useful in esophageal spasm and biliary colic. Nitrates can also relax the smooth muscles outside the blood vessels in the GIT. They are useful in esophageal spasm and biliary colic. Lastly, they are also useful in cyanide poisoning. Sir, why do we use nitrates in cyanide poisoning? Because if you see, nitrates combine with hemoglobin to form methemoglobin. Nitrates can combine with hemoglobin in the body to produce methemoglobin. This methemoglobin acts as a cyanide chelator. It can form cyan-methemoglobin. Methemoglobin is a cyanide chelator. It combines with cyanide, cyan-methemoglobin is formed. Now when we administer sodium thiosulfate, cyan-methemoglobin will react with it to form sodium thiocyanate, which can be easily excreted. So, how do nitrates work in cyanide poisoning? Nitrates combine with hemoglobin, form methemoglobin. Methemoglobin is a cyanide chelator, forms cyan-methemoglobin. Cyan-methemoglobin combines with sodium thiosulfate to form sodium thiocyanate, which can be excreted. So, nitrates are effective in cyanide poisoning. So, this question has been asked. Nitrates are not found to be useful in which of the following conditions? Answer: yes, they are not found to be effective in option D, renal colic. Esophageal spasm, biliary colic, and congestive heart failure are indications of nitrates. They are not effective in relaxing the genitourinary tract. Hence, they have no benefit in renal colic. Next, what are the adverse effects due to nitrates? Nitrates are vasodilators, so they can cause throbbing headache due to vasodilation in the central nervous system. There is also flushing or excessive sweating. What will happen because of vasodilation? Blood pressure will fall, and as BP falls, reflex tachycardia occurs. So this is something similar to the dihydropyridines. We have seen that dipines also cause hypotension, reflex tachycardia, throbbing headache and flushing. Also, we have seen methemoglobinemia is an adverse effect. The nitrates combine with hemoglobin to form methemoglobin. And of course, long-term use can lead to tolerance development. On long-term administration, tolerance can develop to nitrates. So, this is regarding the first group of drugs, that is nitrates. The two other groups, beta blockers, we have already covered in drugs for hypertension. Calcium channel blockers also we have covered in hypertension. Okay, beta blockers and CCBs we have already covered. The remaining topics in angina we will discuss in our subsequent videos. So, see you guys. I'll see you in the next video soon.